Next segment tonight, you may remember this statement by President Obama and the reaction to it by Congressman Joe Wilson.
There are also those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally. It's not true.
Well, now the illegal alien Obamacare controversy is coming to a head. It is still possible illegal immigrants could participate. Writing today in the New York Times, Cardinal Mahoney of Los Angeles says, quote, "How is the health of the entire country helped when the Senate will not even allow immigrants to use their own money to purchase their health insurance? To deny our immigrant brothers and sisters basic health care is immoral." Despite the Cardinal's plea, we all know that if illegal immigrants are waved into Obamacare, there's going to be a major controversy, a major problem for the president. Here now, social analyst and Columbia University professor Marc Lamont Hill. All right, I know you agree with Mahoney, Cardinal Mahoney, and you know, as a humanitarian, it's hard to say that Jesus wouldn't want everybody to get health care.
Right.
On a humanitarian basis, you don't argue it.
Right.
On a fiscal basis, you have to argue it. You can't pay for the health care of the entire world, and we have 10 million illegal aliens here who shouldn't be here. They should be back in their own country. I'm just giving you the theoretical argument that they're here illegally, they should be back in their own country. America's going bankrupt. We owe $12 trillion, and now you want to pay for the health care, or a part of it, of 10 million people. Yeah, humanitarian-wise, that's right, but the country's going to go broke. Those are the two arguments that have to be considered.
I would say you're misrepresenting the humanitarian angle, because those of us who are humanitarians also believe that it makes good fiscal sense to do this. Otherwise, people will be in emergency rooms, they won't get preventative care and all those other things.
You can make an argument for that, but the entitlement would overwhelm the day-to-day care that they receive. It would. It's just it's an amazing thing. Now, so President Obama is now caught because the left, you and your pals, you want...
prefer comrade.
Comrade's a very fine.
Thank you.
Very fine. In fact, you can wear that little red hat that you left in the green room the next time you come out here. You guys want this built into the health care bill. Obama would have to veto it, or he looks like a liar.
Well, and that's just the point. Obama has already backed himself into a corner because he has agreed to the premise of the xenophobic right. When Joe Wilson yells, "You lie," instead of sticking up for what's right, Obama makes a decision to say, look, I'm not going to cover...
Well, maybe he believes that it's not correct to cover people who shouldn't be here. Well, maybe he actually believes that.
Well, you know what? That's great, but since you all have spent so much time saying that he's this radical socialist, it's hard to imagine that now you think that he has a centrist or right-wing position. But thank you for conceding. I'm not the guy
pushing a radical socialist agenda. I mean, you know, you watch this program.
No, not you personally, but you tend to be on this issue in the same camp as those who do that. I'm talking about on the health care issue and on the immigrant issue, not in general.
The health care issue is very clear. President Obama says illegal aliens are not going to get the entitlement.
Right.
Okay? The left says... no, we want him to. So
he's going to do
what
both.
Does he do?
Here's what he does. He does a perfect bit of political sophistry, and that's what he's done so far. He says, look, we're not going to cover anybody who's illegal. And then what he does is he just makes everybody legal. He just gives everyone amnesty. So he can say, look, I didn't lie. I didn't give anyone coverage to it.
You know how that's going to play? Do you know what
I know exactly how it's going to play.
Tell us how that's going to play.
The right will be satisfied because they'll say, look, we won. We got illegal immigrants not to get health care. And then Obama's next big battle will be trying to make everyone legal.
Okay.
But it's not going to pass because he's lost so much political capital. So who loses? The left loses.
No, but
undocumented workers lose.
Listen, you know as well as I do. And I don't think it's going to happen, by the way. I think the Senate bill, not the House. See, the House has got them included, the illegal aliens, and the Senate doesn't. That's what Mahoney was writing about. I think the Senate's going to prevail on this. But let's just say the House prevails, and that it is written in that if you are an illegal immigrant, you can, with your own money, buy into the government-run health care, whatever it may be, because it's subsidized. So you can buy it. That's what Mahoney doesn't say. With all due respect to the Cardinal, he doesn't say what the whole thing is. You can buy in, but if you don't have any money, the government helps you. The government gives you money to buy. Right. So if you're an illegal alien and you're making $20,000 a year, they're going to let you buy in and give you money on top of it. That is going to infuriate most Americans. They're going to be furious about it.
No, it's not.
Oh, yes, it is.
Yeah, the next time there's a swine flu outbreak and you find out that the person who you got it from got it because he didn't have health care,
why do you think,
I think you'd
why do you
agree
think
with this.
The Kennedy-McCain bill died? Because most Americans didn't want entitlements for illegal aliens.
This idea of, it's all about the way things are framed. It's the same thing we said about the public option. I showed you a poll that said that Americans were for the public option. You said, oh, it depends on how it's framed. Ignore it.
Right.
Well, it's the same thing with this issue. Nobody Nobody wants to be in a country where people have diseases that aren't treated.
So
Nobody
you're going to say, your argument now is you got to give all illegal aliens, 10 million, 15, whatever it may be.
The option to buy health care.
Right.
The option to buy health care.
No, they can buy private now. They can buy private now.
Yeah.
If you're an illegal alien, you can buy private. Because they're not going to check. So you can buy Oxford Health and send them a check. So don't give me that. No. So the illegals can get private insurance.
The undocumented work, yeah.
Yeah, undocumented work, whatever swell thing you want to put on it, they can get it. So that's bull. What Mahoney wants is he wants the poor people, as Jesus would want, and I see that, to be covered. But you're going to tell me the reason they should is so they don't get a disease. That's what you're going to tell me.
No, I'm saying that's another issue. One issue is an economic issue. If we don't do this, they end up in emergency rooms. They don't get preventive care. That is a taxing on us. And I just don't like the way you're slipping into these secular progressive values, Bill. It's making me very uncomfortable, especially around Christmas time.
I know. But you would see that this is a real tight spot for President Obama.
He's in a tight spot. He's going to cave to the right, just like he did on the public option, just like he did on these bailouts.
You think so? He's going to cave?
He always caves. I'm very disappointed.
Right. He's not going to invite you to the Christmas party if you keep this up. You're not going.
I don't think I'm invited anymore.
Marc Lamont Hill, everybody.